Hello and welcome. Today we're diving into the world of conjunctivitis, more commonly known as pink eye. We'll explore what it is, what causes it, and how to manage this common eye condition. Conjunctivitis arises from various sources. Viral infections, often linked to the common cold, are frequent culprits. Bacterial infections caused by organisms like Staphylococcus or Streptococcus are another key factor. Allergens such as pollen, dust mites, or pet dander can also trigger allergic conjunctivitis. Irritants like smoke, chlorine, or foreign objects in the eye can lead to irritation. Less commonly, conjunctivitis can be associated with sexually transmitted infections or autoimmune diseases. Let's break down how conjunctivitis works. The conjunctiva, a clear membrane covering the white part of your eye and the inside of your eyelids, becomes inflamed. When a virus or bacteria invades, the body's immune system responds, leading to dilation of blood vessels in the conjunctiva. This increased blood flow is what gives the eye its characteristic pink or red appearance. In allergic conjunctivitis, the release of histamine by mast cells causes similar inflammation and itching. Conjunctivitis is incredibly common, affecting people of all ages and backgrounds. Viral and bacterial forms are particularly prevalent among children in school and daycare settings due to their contagious nature. Allergic conjunctivitis tends to be more common during allergy seasons. Overall, conjunctivitis accounts for a significant number of eye-related doctor visits each year. So, how do you know if you have conjunctivitis? Key signs and symptoms include redness in the white of the eye or inner eyelid, swelling of the conjunctiva, increased tear production, a gritty feeling in the eye, itching, burning, blurred vision, and sensitivity to light. In bacterial conjunctivitis, a thick, yellow or green discharge is common, often causing the eyelids to stick together, especially in the morning. Viral conjunctivitis typically presents with a watery discharge. Diagnosing conjunctivitis usually involves a simple eye exam by a doctor or optometrist. The doctor will look for characteristic signs like redness, swelling, and discharge. They may ask about your symptoms and medical history to help determine the cause. In some cases, a sample of the discharge may be taken and sent to a lab for testing to identify the specific bacteria or virus involved, especially if the infection is severe or recurrent. Conjunctivitis can be broadly classified into several types. We have viral conjunctivitis, often associated with a watery discharge and possibly a recent cold. Then there's bacterial conjunctivitis, typically presenting with thick pus-like discharge. Allergic conjunctivitis often involves intense itching and watery eyes, usually affecting both eyes. Finally, there's irritant conjunctivitis, caused by exposure to irritating substances. Treatment for conjunctivitis varies depending on the cause. Viral conjunctivitis usually resolves on its own within a week or two with supportive care, such as applying cool compresses and using artificial tears. Bacterial conjunctivitis is typically treated with antibiotic eye drops or ointment. Allergic conjunctivitis is managed with antihistamine eye drops or oral antihistamines. It's important to avoid touching your eyes and wash your hands frequently to prevent spreading the infection. For irritant conjunctivitis, rinsing the eye with water and avoiding the irritant is usually sufficient. Preventing conjunctivitis involves good hygiene practices. Wash your hands frequently with soap and water, especially before touching your eyes. Avoid sharing personal items like towels, washcloths, and makeup. If you wear contact lenses, clean them properly and follow your doctor's instructions. If you have allergies, try to minimize your exposure to allergens. Teach children the importance of hand washing and avoiding touching their eyes. The prognosis for conjunctivitis is generally excellent. Most cases resolve completely with appropriate treatment and management. Recent research is focusing on developing more effective antiviral medications for viral conjunctivitis and exploring new approaches to manage allergic conjunctivitis. Scientists are also working to improve diagnostic methods for rapid identification of the causative agent, enabling quicker and more targeted treatment. Thanks for joining us as we explored the topic of conjunctivitis.